When it comes to this right here, this has just been released by TBS. It is a wonderful, wonderful product. It's the TBS Bone Plug. This is a bone grafting plug that you can actually use for a bone graft instead of particulate allograft. This does not take the place fully of particulate allograft with a membrane over top. But what you can do, maybe for patients who don't want to have a bone graft, maybe a patient that's having a bridge, maybe a patient that is unsure of getting an implant. They want to take a lot more time than 6 months to decide. You can place one of these into the socket because these take about 9 months to fully turn over into native host bone. So the TBS Bone Plug, what is it? It is calcium phosphate-based material. It is synthetic carbonate apatite that closely resembles natural bone. Its composition is about 80% mineral and about 20% collagen. So think of it as a mineralized collagen plug. It has minimal collagen in it. It is mostly mineral. And so when you put this into the site, this is going to be your bone graft. Very nice design. So the good thing about carbonate apatite is that it's more similar to the apatite that's found in natural bones and natural teeth. It has higher osteoconductivity and has faster resorption by the cells. So what does that mean for us? Meaning that it's osteoconductive and means it wants the cells to come into it to grow native host bone. And so that is as compared to its cousin hydroxyapatite, which does not attract the host bone. It's significantly superior to just a collagen plug. The reason why is that it holds the host bone there so that it can receive the cells from the host. You do not have to use a membrane with one of these to hold the plug in place. Do I recommend sutures? Yes, we do recommend sutures for these, but you do not have to have a membrane in place. It's 80% mineral. This actually fills the socket when it's hydrated. So as soon as these start filling with some sort of liquid, they start expanding into the site. So say you have a double-rooted tooth, you can actually cut the plug in half and put part of it in each one of the sockets. And as the socket fills with blood, you start seeing the actual plug start to expand. And that's really, really nice. You can do a really, really fast bone graft with these. And so it enhances the preservation of the alveolar ridge. You can fill a periodontal defect if you want to. It's very porous and it stabilizes the blood clot. So you're going to get hemostasis, but you're also going to get bone formation in this side as well. The good thing is that it does turn over fully into host bone. Does it take longer than a traditional allograft? Yes, it does. These take 6 to 9 months to fully turn over. And so after about 9 months, you're going to have adequate host bone in order to place an actual implant into the patient, which is very, very nice. And so when it comes to doing these, it's very, very simple, very, very quick, and you can charge for a full bone graft when using these. So as you hydrate these, you can easily see how they start to expand into the site. So we're just adding water to this, but you can actually see how it starts to expand. Very nice here. So here's an example. This is a patient of mine. This tooth needed extracting. The patient is unsure if they want to do implants. And, we're in Kentucky, so everyone's missing teeth here. But this is my setup afterwards. So, the TBS Bone Plug, I have my 3D instrument kits, I have my bloody tooth guy, elevators. So the tooth is out of there, but when it comes to doing a graft, how long does this actually take? I have my plug and I can just put it into the site. I can suture over top of it and I live to fight another day. This is a bone graft that takes 1 minute, if you will. You spend more time opening the packaging than you actually do using the actual bone graft material versus actually having to manipulate it down to the bottom of the sockets, having to drape a membrane, and then having to do a bunch of sutures over top to hold everything closed. This is something you can do really, really easily, especially if you are new to alveolar ridge grafting. This is post-operatively about 2 weeks later. Sutures are intact. We see some nice clot formation over top of this and some soft tissue formation. Same thing. This is another patient of mine. Post-bone graft. We can see all the particles really closely in this photo here. So it's mostly particle and a little bit of collagen. So as it fills with blood, you can start seeing the expansion of the actual bone plug. And then I have sutures over top of this. And I sat and I took a bunch of pictures of this one over the course of about 5 minutes, just so I knew what it would look like as I start using these more and more. And it's a very, very nice product. This patient here, I actually see him a lot. He brings his grandson to the same basketball league that my son plays in, but again, he was unsure if he wanted an implant up at this maxillary molar, so I decided to do him a solid. I said, you know what? I can have a new product here. Let me try it out on you. We're going to see how it heals. And after about 9 months, I'm going to give him the option to have an implant if he wants to, but he was unsure about it and he didn't want to pay for a bone graft. So I was able to do him a solid here with a product that's going to do him a lot of good, but also it's not economically crazy for me to do this for somebody. So instead of using a colla-plug, and in surgery, a lot of times people will call using a colla-plug the poor man's bone graft. But a colla-plug is not a bone graft. It's only there for hemostasis. This right here is going to give him something to keep the ridge wide and to keep it tall whenever he goes to have an implant. This was actually today. He came in today, and this is what it looks like. He has some immature tissue formation. This is 3 weeks post-operatively. This is exactly what you would see if you were to place a membrane over a bone graft. You kind of see that immature tissue formation after 3 to 4 weeks. This is exactly what this looks like 3 weeks later. This was this morning at about 9 o'clock on this patient. So very nice gentleman. I do think he's going to end up getting an implant in this area.